This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
I'm your host, Taylor, and today we're going to talk about drugs that mimic the sympathetic nervous system. This system is responsible for your fight or flight response. More specifically, it affects dopamine, norepinephrine, and epinephrine inside the brain. The substances we are going to talk about today have a very limited therapeutic role and are now widely used as drugs of abuse. This toxidrome is defined by a state of sympathomimetic excess, typically causing those effects expected from the fight or flight reaction. This is the toxidrome that can sometimes be mistaken for anticholinergic, and today we will discuss some key differences that can help differentiate two patients who are brought into your emergency room. So what are the types of sympathomimetic drugs? The first one we'll talk about is amphetamines, such as methamphetamine, Adderall, Ritalin, and Vyvanse. The next one is MDMA, also known as Ecstasy, or the rave drug. The third one is cocaine. Both Theophylline is another drug in this class that is used for asthma. Ephedrine, oftentimes used in the operating room setting for low blood pressure, is another drug in this class. Benzylpiperazine, or BZP, is another one. Oxymetazoline, or Afrin. Sudafedrine, or also known as Sudafed. And finally, MAO drugs used for treatment-resistant depression. So what is the mechanism of action of these drugs? The sympathomimetic drugs act via several different mechanisms. Phenylephrine acts directly on alpha-adrenergic, beta-adrenergic, and dopaminergic receptors. Cocaine acts as a CNS stimulant. This is what actually causes the sympathomimetic toxidrome. It acts via blockade of presynaptic reuptake of norepinephrine, dopamine, and serotonin. Of note, it is the increase in norepinephrine that causes the adrenergic effects traditionally seen, including vasoconstriction, while the increase in dopamine is what leads to the euphoria, psychic energy, heightened sexual excitement, and self-confidence. The second mechanism of cocaine is it acts as a sodium channel blocker that causes both anesthetic and arrhythmogenic properties. Methamphetamines and amphetamines facilitate the release of these neurotransmitters from presynaptic terminals. Monoamine oxidase inhibitors prevent the breakdown of sympathomimetic amine neurotransmitters, increasing their effects. So let's talk about the presentation of a patient with a sympathomimetic toxidrome. Typically, this patient will present to the ER agitated with sinus tachycardia and hypertension. More specifically, they may also present with hyperactive bowel sounds, diaphoresis, and hyperthermia as a consequence of increased metabolic rate. There will be no GU retention. The patient will also have mydriasis. If the toxidrome is severe, symptoms may include angina and seizure. In life-threatening overdoses, derangement of cardiac output can occur that decreases diastolic filling time, coupled with arrhythmogenesis that can result in circulatory collapse and shock, which may be refractory to fluid resuscitation and pressor agents. So let's talk about diagnosis. This toxidrome presents very similarly to the anticholinergic toxidrome, except that in a sympathomimetic patient, there will be diaphoresis and hyperactive bowel sounds. This is a markers and a chest x-ray. Other helpful tests may include blood gas, BMP, CK, coag studies, and a U-tox. Keep in mind that although ordered frequently, a U-tox does little to change management for a patient in the ED, as it gives no timeline to when the substance was actually taken and oftentimes does not pick up different types of compounds.
The cardiac effects that may be seen on an EKG may include sinus tachycardia, tachydysrhythmias, ST segment elevation, and T-wave inversion. Sodium channel effects in cocaine may cause widened QRS and Brugada morphology. So what is the treatment of a patient in the ER? The biggest goals of treatment are to protect them from adrenergic crisis. This is a stroke and heart attack, and severe agitation, sometimes referred to as agitated delirium. After starting with the ABCs, IV hydration and temperature monitoring will be crucial. Benzodiazepines are the mainstay of treatment and may be given for agitation or for seizure. Benzos may improve hypertension, although should not be used solely for hypertension. If it is a clear case that the patient is in a hypertensive emergency, nitroprusside may be used for refractory hypertension. Hyperthermia can be a poor prognostic indicator, and cooling with ice baths or cool spray may be both useful and critical. There's a lot of controversy over this, but many references and board exams recommend avoiding beta blockers due to unopposed alpha agonism that would cause a spike in blood pressure due to peripheral vasoconstriction. Whole bowel body irrigation may be used to decontaminate stable body packers, but once a packet is ruptured, they may require surgical removal. If the CK level is high, begin aggressive IV hydration with a goal of a urine output of 3 milliliters per kilogram per hour. Okay, let's talk about disposition of your patient. As with any toxidrome, the disposition depends on how much substance has been ingested and how stable or unstable the patient actually is. Keep in mind that the history may oftentimes be inaccurate, and clinical acumen will be vital to this patient's disposition. Also, different classes of sympathomimetic may last for varying periods from minutes to hours. Oftentimes, a period of observation will be necessary before any disposition decision is made. Keep in mind that body packers pose a significant risk and must be watched very carefully. All right, guys, it's time for a recap. Sympathomimetic drugs are represented by a wide range of drugs, many of which are illicit substances. These substances mimic the sympathetic nervous system, which is your fight or flight nervous system. The key presentation of these patients will be diaphoresis and hyperactive bowel sounds. That will help differentiate from an anticholinergic toxidrome. Treatment includes stopping the offending agent, providing supportive care, and benzos as a mainstay of treatment. Be careful with body packers as their presentation can change dramatically during their ER course. Remember to always use poison control as a resource. That's all, guys. Thanks, and tune in next time.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show